As a golfer, we all know that low back pain is a common issue that we suffer from. And today we want to talk about some of the issues that we get as golfers, demystify some of it, talk about how the hip plays a role in it, and we're going to demonstrate some great exercises you can do to help prevent it. Hi, I'm Dr. Kevin Christie, a local sports chiropractor that is TPI certified, and I got Matt Close here as a TPI certified fitness trainer, and we're going to collaborate on some information here and go over some injuries, and then he's going to demonstrate some exercises you can do to help prevent it. So right out of the gates, I want to talk about a common issue that we see. If you're a right-handed golfer and you're coming back and then you're coming through here, a lot of times we see, go ahead and face that way for me, Matt. We'll see a lot of right-sided low back pain here because there's kind of that crunch during the downswing. And so we see a lot of pain here. Now, it's not just limited to that, but it's common. But then we can also get pain down into the hip area as well, all the way into the mid-back. And what's interesting about the low back and some of the issues we see with golfers is that to have a proper functioning body for the golf swing and many activities as well, but we'll just relate it to golf, is you need good mobility in the mid-back and you need good mobility in the hip joint. If you don't get the good mobility through there, you're going to chew up the lumbar spine here and try to ask this to do too much. And so whenever we assess a golfer with this injury, we're looking for mobility here, and then we want to have core stability that we all have heard about. But the point of today's video, we're going to really break down this hip joint and make sure, you can go ahead and face this way now, make sure that you are getting the proper mobility in there to prevent that wear and tear on the low back. A lot of the golfers we evaluate, we see the restrictions, whether it's in rotation or flexion extension in the hip. And Matt's going to do a great job of showing you 3 things you can do to help prevent this. Now, if you're dealing with pain right now, I highly recommend seeing a medical provider to make sure that you don't have any underlying issues that are red flags. But if you have that clearance, some of these fitness aspects can really help you. So you're going to show us a few things,
yeah,
right?
I'm definitely going to show you 3 great exercises. Definitely going to help to not only open up the hip, but also strengthen it as well.
Perfect.
So here are the 3 exercises we recommend to do before and after your round. The first exercise is the 90-90 hip stretch. The second exercise is a half kneeling hip flexor stretch. And the third exercise is a strengthening exercise that's called the single leg or double leg glute bridge. So first, you're going to get into a 90-90 position. You want to make sure we have a nice erected spine. We want to make sure both legs are at a 90-degree angle. We're going to take the outside arm of the front leg. We're going to prop our chest up, stay nice and tall. Imagine we have a stick that's going from the floor and we're going up towards the ceiling. Now we're going to lean our chest over the front knee and we're going to start feeling a stretch in our right glute. If you want to get a deeper stretch, you can put your left hand on the insole of the foot and you're just going to lean a little more forward. Make sure we don't round the back. We're going to do this about 8 to 10 reps. Once you get done, you perform the other side. The next exercise is going to be a half kneeling hip flexor stretch. So first, we're going to get in this half kneeling position. Make sure we both have both sides at 90-degree angles. And the biggest thing to maintain here is we're going to maintain what's called pelvic tilt. So all we're doing is feeling like our belt buckle is going up towards the ceiling. Maintain this pelvic tilt, and we're going to slightly lean forward, and we're going to start feeling a stretch on our quad and our hip flexor. To get a deeper stretch, you really want to get more of a tilt, and I could feel a big stretch here. If you want to get even deeper, we can take our left hand up and then do a little side bend and keep on pushing forward and maintaining this tilt. We don't lose it. And we're going to hold this stretch for 30 seconds to 90 seconds. After you get done, once you mobilize your hip, you actually want to strengthen it. That's going to help to reiterate this movement pattern to help strengthen the body after we released it. So what you're going to do is you're going to lay on your back. And the thing we're going to focus on is being on our heels, because that's going to help to strengthen the quads and also activate the glutes. So we're going to put our hands to our side. We're going to lift our butt up. Make sure we don't use our lumbar spine. We're squeezing our glutes. And we're going to go down, maintaining that tilt. Go up and down. If that's too easy, you're going to go to single leg. The leg that's up is going to be at 90-degree angle. Once again, you're going to lift the hips up, squeeze the glutes, and come back down. You're going to perform the double legs anywhere between 10 to 20 reps, and single legs anywhere between 10 to 15 reps. Now those are 3 exercises we recommend. Hope you guys like them and let us know how you guys do with them.